Okay, welcome to this short presentation which aims to explain the rationale for SLEs, supervised learning events, and provide some background information on formative learning. My name is Fiona Cameron and I'm Chair of the Academy Foundation Assessment Working Group. Next slide, please. The UKFP Foundation programme is designed to provide a broad range of experiences in clinical practice in both primary and secondary care in a range of clinical settings. These experiences will provide the Foundation doctors with a range of clinical encounters which they can use as evidence of completion of the Foundation professional capabilities, which will in turn allow them to demonstrate the higher level outcomes. Next slide, please. In this presentation, I will explain the concept of formative learning and provide information on Miller's pyramid, which is referred to in the curriculum document. We will explain what an SLE is and how they should be used. We will also explain how they should be completed. We will also take a look at some of the other forms in the portfolio that can be used to demonstrate your curriculum coverage, including the Leader form, the Learn form, and the DCT forms. Next slide, please. Formative learning forms the basis for learning in the clinical environment. By receiving constructive feedback on your clinical encounters, you're able to show progress in your performance, including your behaviours. SLEs, supervised learning events, are formative learning events, and they're not pass-fail. They allow you to demonstrate the knowledge and clinical skills together with the required behaviours and communication skills in the workplace. They sit at the top of Miller's pyramid. By undertaking a range of SLEs, you will receive feedback on your performance. This will provide you with valuable feedback on the areas where you're performing well and also guide you to further learning where development is needed. Next slide, please. Portfolio is where all the evidence of learning and progress is recorded and stored. SLEs form a part of this learning, in addition to various forms of feedback on behaviours and team working. It is very important to remember that these are not pass-fail and that the feedback you receive is where the value lies. Next slide, please. In order to demonstrate completion of the Foundation curriculum, the Foundation doctor will be required to provide evidence on completion of the 3 higher level outcomes. Underpinning each of these higher level outcomes, or HLOs, are 13 FPCs. Each FPC will require several pieces of evidence to satisfy completion. The number of pieces of evidence is not stated. However, the Foundation doctor will be expected to provide a range of evidence as defined by Miller's pyramid. The curriculum mentions Miller's pyramid and the hierarchy of evidence. SLEs sit at the top of the pyramid and provide the highest level of evidence of experiential learning. By completing an SLE, you can demonstrate in the workplace that you have the required knowledge, the skills and behaviours to meet the FPC. SLE should be completed in physical and in mental health, and in both primary and in secondary care. The curriculum states that where SLEs are completed for each FPC, there should be an SLE performed for physical health and also the equivalent mental health condition. For example, if for FPC2, evidence for acutely deteriorating physical health condition might be an assessment of, say, ventricular tachycardia, then the equivalent mental health might be management of an acute psychosis or delirium. For each FPC, the Foundation doctor should aim to provide evidence from each level of the pyramid, i.e. knowledge by providing a learning log, reflection on a case or your learning feedback on simulated sessions and also SLEs. For HLOs 1 and 2, it will be expected that the SLEs will form a large part of the evidence. However, for HLO 3, this will mainly need evidence of learning and portfolio and professional development. Next slide, please. The question that everybody will be asking is how much evidence and what type of evidence do I need to submit and link? While there is no minimum number of evidence, we would anticipate that the foundation doctor will have around 5 pieces of evidence per FPC. It will be possible to link up to 10 pieces per FPC, and we'll be looking for a range. Each FPC should have a range of evidence, and the suggestion is that each one has at least one SLE, ideally 2, to ensure that mental health coverage, some learning underpinning the focus of the SLE, feedback, reflection and simulation if this has been achieved. Next slide, please. Let's look in a little bit more detail about the types of SLE. There are 3 main types of SLE. These are namely DOPS, mini-KEX and CBD. Let's take each one in turn. A DOPS, or directly observed procedure, is where you choose a procedure and ask to be watched by a senior colleague, and then you will receive feedback. Examples of this might include arterial blood gas sampling, performing an ECG, taking blood cultures, etc. Knowing when to do the procedure and obtaining consent are as important as the technical process. A mini-KEX, or mini clinical evaluation exercise, is where you choose a clinical encounter with a patient and ask to be directly observed by a senior colleague and receive feedback. Examples may include initial assessment of chest pain, or perhaps an assessment of delirium or psychosis. A case-based discussion is a CBD. In this situation, you choose an interesting case, discuss with a senior and receive feedback on your knowledge and performance. This may be as part of the post-day ward round, discussing in a supervisor meeting, or presenting at a departmental meeting. Next slide, please. Let's take a look at the Learn form. This is a form that can be found in the portfolio, both in HORAS and in TURAS. It's multi-purpose and it can be used to record any of your SLEs in place of the SLE forms such as DOPS, mini-KEX and CBD. It may be used to record your reflections. You might also find it to be a useful form to record any simulation teaching that you have attended. It is an interchangeable form with the SLE forms, and you may wish to use this form in its place. What it cannot be used for is for clinical supervisors meetings and educational supervisors meetings. Next slide, please. Other forms that you will see in the portfolio are the LEADER and the DCT forms. The LEADER form can be used to record any leadership activity. Remember, leadership can be at ward level, for example, leading a ward round or leading a medical student session. It doesn't need to be a formal leadership role, such as a leadership fellow or regional rep. The DCT form is the developing the clinical teacher form. It's a form that you can use to record any sessions where you have taught others. You may want to use the Learn form in place of the LEADER form and the DCT, and this is perfectly acceptable. The choice is up to you. Next slide, please. Let's have a look at how you would actually record an SLE. So when you're in the workplace and you decide you want to record an SLE, you need to try and plan this and try not to do this retrospectively. When you think there'll be an opportunity to undertake an SLE, please speak to your senior colleague in advance and ask them to watch you undertake the clinical encounter. They should then give you verbal feedback with suggestions for development. You then log into your portfolio, send a ticket request, and once they have received the ticket, you can then upload that. They will complete it, and then you can upload this to your selected FPC. Next slide, please. Not all SLEs will be suitable to evidence all HLOs. You can see here that the clinical SLEs mainly support HLO1 and HLO2. However, TABS, PSG, LEADER and DCT might be more suitable to HLO2 and HLO3. When you try to record an SLE, try to plan this in forwards and not be retrospective. Next slide, please. In summary, SLEs are critical to your completion of the foundation curriculum. You should regard them as learning opportunities to demonstrate your knowledge and progress. Please remember to ensure that you have sufficient to demonstrate mental and physical health. Next slide, please. Thank you for listening. A fact sheet is available and further information is available in the UK FPO curriculum.